Good morning, everyone, and welcome to my presentation. I would like to introduce to you in my PhD thesis, which is the effects of respiratory therapy on pulmonary function for patients with cerebral palsy. My name is Erika Kolumbán. I'm a first-year PhD student. I'm a conductor-teacher and working at András Pető Institute, Semmelweis University. My supervisor is Ibolya Turi and Mark Hernát-Fői. As a conductor, my vision is to improve the life quality of children with cerebral palsy through better rehabilitation and to contribute to the world recognition of the conductive education. In order to achieve my vision, I would like to improve the general condition of the cerebral palsy patients by applying evidence-based breathing exercises in their rehabilitation care. Here you can see an overview about my two researches. The first of one, I am investigating the effects of additional respiratory therapy on pulmonary functions for patients with cerebral palsy by writing a systematic review and conducting a meta-analysis. On the second one, we are investigating the effects of conductive breathing exercises on pulmonary functions of school-aged children with CP by writing a study protocol and conducting a randomized control trial. Let me introduce to you, in the first of our first research, the effects of additional respiratory therapy on pulmonary functions. Let me give you a short information about the background. The cerebral palsy is one of the most common disabilities among the children. It affects 1.6 children for 1,000 live births, and this figure is more than double in low-income countries. Cerebral palsy affects not just the neuromuscular system, but also the respiratory system. And due to this, the leading cause of death among this population is due to dysfunction of the pulmonary system. Children with CP undergo conventional therapy, which mostly focuses on the motor development of the child. However, there are existing additional respiratory therapies with a device or series of breathing exercises or different manual techniques. Our aim is to figure out the effectiveness of additional physical respiratory therapies on pulmonary functions and respiratory strength. The question is, does the additional therapy change mortality and pulmonary functions compared to the conventional one? We would like to include patients with cerebral palsy and to compare the conventional therapy versus additional respiratory therapy. And we measure changes in the pulmonary functions, overall survival, and quality of life. The implication of this research would be the improvement of overall survival, quality of life via additional respiratory therapy. We hypothesize that this kind of additional respiratory therapy will improve the pulmonary function in patients with CP. We conducted a systematic research on different databases. And here you can see the final search key, which contains two domains, the cerebral palsy domain and the intervention domain. We find more than 14,000 hits, and after the duplicate removal, we finalized that we will include 17 articles based on full text eligibility. Now I would like to move on our second project where we would like to investigate the conductive breathing exercises effect on the pulmonary system. To the background, in the photo you can see Dr. András Pető, who was a Hungarian physician who developed and established the conductive education system in order to rehabilitate the children and adults with cerebral palsy. The conductive approach is a holistic approach which includes also conductive breathing exercise series in order to improve the general condition of the children with CP and to improve the pulmonary function, strengthen the respiratory muscles, and health-related quality of life in patients. Dr. András Pető didn't write a protocol about it, and no similar research has been done on the subject. So a randomized control trial is needed based on a new protocol. We hypothesize that the conductive breathing exercises based on the original theory of András Pető improves the pulmonary functions of patients with cerebral palsy. The question is, does the protocolized breathing exercises change the pulmonary function of children with CP? According to this, we will include school-age children with CP, and we will compare the non-protocolized breathing exercises versus protocolized one, and we measure the changes in the pulmonary function, muscle tone, and quality of life. With our research, we will contribute to the improvement of overall survival, quality of life via conductive breathing exercises. The hypothesis is the conductive breathing exercises will improve the pulmonary functions. In our randomized control trial, we will include school-age children in all range of gross motor function classification level, and children who attend continuous conductive education and can understand the comments of the conductor, and children who don't need any respiratory support. Here you can see a short summary about these two very important projects of mine, what I'm planning to finish next year, May, and in October. Let me finish my presentation with a quote from a very famous English politician, Winston Churchill, who said, "Success is going from failure to failure without losing enthusiasm." Thank you for kind attention.
Thank you for your presentation. I would like to ask, what is this protocol? Is it elaborated by you? And what kinds of protocol are you going to compare? Are you going to add one more to this one? Or how are you going to find the best protocol to this intervention?
We are conducting already a literature review based on the original case reports written by András Pető and his colleague Maria Hari, and we analyzing his documents, and based on these historical papers, we will write our new protocol. At the moment, the professionals performing the breathing exercises somehow in an ad hoc basis based on personal beliefs or experiences. And this is what we want to change.
Congratulations for excellent presentation. Could you tell something more about this breathing exercise? What kind of breathing exercise do you use in your practice, and what is your what do you want to choose for this examination?
Mm-hmm. The conductive rehabilitation program is really a complex idea of rehabilitation, and the conductive education concentrates not just only on the motor development, but also on the cognitive development, emotional development, and so on. And in our program, we are trying to include and to develop at the same time all areas. So that means if we are performing series of motor exercises. We are also including in these motor exercises the breathing exercise series. For example, before this motor series, we open the window so to be able to perform the exercises in a fresh air, and we are starting to with a strong and slowly breathe out, and we are showing to the children how long should they breathe in to keep the air in the lungs, and after that to breathe out. After that, the breathing is combined with vocalization, and it took around 5 minutes. But it's not just only once in a day, 4 or 5 times daily, repeated.